Good afternoon once again. Today is Friday, the 8th of January, 2021, and this is the English language briefing here at the Center for COVID Situation Administration, or CCSA, as we have every day. So I'll start first with the general situation and the number of cases that we have right away. The new confirmed cases we have today is recorded at 205 cases, making the cumulative number of cases in Thailand 9,841. Out of the 205 cases recorded for today, 131 are from local transmission, 58 from active case finding, and 16 are those cases that are found of persons already in our state quarantine system. The number of recoveries, those discharged from treatment, we have new recoveries at 734, while the total number of recoveries cumulative is 5,255, with no additional new fatalities for today. Just some observations, some notes that this new wave has affected now up to 57 provinces out of the entire country. Therefore, provinces remaining without any infection at all stands at 20. As for active case finding and active surveillance, that continues. The example that we showed today on screen in the Thai version was in the northeastern or Isan region in the provinces of Khon Kaen and other provinces nearby, where an active surveillance had revealed a result of a number of cases, around 5 to 6 cases in that area. So, the spokesperson mentioned in length a bit about the Mo Chana application, and I'll talk about a little bit about that before going on to the next issue. Firstly, of course, we do have to accept that we have to improve upon ourselves, and in short, we would have to ask the public to bear with us, because as you bear with us, as we go through this learning process, as we improve upon ourselves, our working methods and everything, we have to bear with this daunting challenge together as well. So today there is actually a barrage, a deluge of information, and we all have to mind the fact that we are caught in this commotion and all of these challenges that we must continue to work to adjust ourselves on. So therefore, all the adjustments, all the turns, all the flexibility, all the changes is all for the better. And of course, all of this will lead us to the final destination of solving the COVID crisis in Thailand and around the world. For Mo Chana in particular, we do want the public to use it more in a more widespread fashion. Of course, the benefit, of course, is that it saves time for doctors. Mo Chana saves times for doctors. It controls, of course, the movement, and of course, it controls the various information. It's a combination of all of this information that we have in terms of those who are in risk areas, and all the information is recorded on the application, which is very, very crucial, very, very important for the medical team. So we encourage all of you to use it, and there's no penalty in not using it, but it's very important to use it. The focus of Mo Chana is actually therefore to have no one conceal information, meaning that for those, particularly, especially and only for those who are found infected with COVID, if the intention is to conceal information and they do not have any application at hand, then that would pose as a problem, of course. So the key word is intent. The key word is intention. It's not about whether you downloaded Mo Chana application or not, but it's about the intent. If of course people have the wrong intentions of concealing from the beginning, they wouldn't do anything to help the medical personnel, and that would be very, very bad for our situation, and bad for our society as well. But if the intention is good, if the intention of travelers, for example, inter-province is good, then any form of providing transparent information is acceptable, and it's very good. You can actually, of course, record, for example, your travels, your interaction history before going into risk area provinces. You can record that manually on paper as well. So it's about the intent that you have. But for those who have bad intentions, and in addition to, of course, not recording anything at all manually, or not downloading Mochna application, then that will pose as a problem. So I think the key word, the focus, is to have no one conceal information intentionally. The announcements on Mochna did not intend to cause any alarm, and it is we're very, very happy to hear that in the past 1 and 2 days, there had been a lot of cooperation from society on downloading Mochna already. This includes 2 million new downloads in the past day, and on the 8th of January, as of 8th of January, we have around 3.69 million downloads of Mochna, and we continue to ask and request the general public to download this application, which is very useful in terms of advising people not to go to risk areas, keeping a tab on their risk, the rate of risk, as well as their travels and interaction as well. So therefore, as I would mention just one last time, that any adjustment, any turn, you see in the press a headline there, any adjustments, any turns, all of which is, we can look at it in the way of self-improvement, in terms of all for the better, all in reaching the final destination that we all have to work together for. So in terms of the application itself, we've been urging the general public to download, especially those living in the 5 provinces. It helps, as mentioned, authorities to identify those who have been in close contact with infected persons and help prevent medical practitioners from contracting the disease themselves as well. And I'll go a little bit provide a little bit of information on Mochna. Once downloaded, the users will be asked to answer a few assessment questions, as well as allowing the application to gain access to their GPS location and Bluetooth to track their movements. The AI technology within the software will make the preliminary assessment and give each person a color code. And you will have some slides there that are self-explanatory about Mochna rather. So asking a few questions, giving color code, green for low risk and yellow for those at risk. The color-based identification will change on a real-time basis. And you have one infographic there as an example. In green, this person is in green. Green meaning low risk. And it will also immediately notify users of potential risks once related to COVID case is found. So with a GPS tracking system, this software will continuously assess the areas and movements using big data compiled and recorded, as well as Bluetooth technology to communicate with other devices equipped with the software to continuously guard each person against coming into contact with the virus. Or if entering into a danger zone, the application will send a notification to alert the users to avoid the area. Meanwhile, if the user's profile turns orange, it will signify that the person is a possible COVID-19 carrier. They are asked to go to a hospital and keep a safe distance from others. With the application installed and running, the users will be able to share their information by having medical personnel scan the QR code within their software, reducing the tracing process, the time used for tracing. According to the developers, medical authorities will be able to quickly identify other users with confirmed cases that have in close contact with, thus allowing for easier identification of potential risks and helping mitigate the spread of the virus. Now, I'd like to perhaps, if possible, bring back one picture about the collaboration that I was talking about. The pictures of collaborators of Mochna. It's not only a government government run application, but it also has cooperation from various private sector people as well. So many of you may have had security concerns about the application. So a little bit more about the protocols. The application has layers of privacy preserving safeguards in place. All data collected is stored and displayed in an anonymous form. Users will only be asked to share these records if contacted by the authorities as part of the tracing investigation. The operation provided by Mochna strictly adheres to privacy and data protection laws. The application will only be active during the pandemic, and all logs will be deleted immediately after the COVID-19 crisis ends. The data collected is thus entirely for medical purposes only. Mochna is also available on App Store and on the iOS Play Store on Android operating system, and you can download the application via the QR code as well. And you have a QR code on screen for you right now. So that's about Mochna, in which the spokesperson mentioned in length about. It's very important. I'd like to stress about the usage of Mochna, the sustainability that we want Mochna to have. Hope for the sustainable use. It will be very useful. It signifies the cooperation of the public. It reduces the medical personnel's time in tracing. That being said, of course, we'll continue to improve the work and the communication of the CCSA on issues that are very important to our audience. So moving on to one piece of information which is important is about the assistance that we have to neighboring countries. The Foreign Ministry, through the Thailand International Cooperation Agency, is working to support neighboring countries, including Myanmar, Cambodia, and Laos, as neighbors and as brothers and sisters to contain the virus. And it has led also a coordinated effort among Thai agencies to strengthen the response in the region since March of last year. As the outbreak, of course, is a regional, is an international, it's a global issue that requires cooperation and concerted efforts internationally. So TICA, this agency, is collaborating with the Department of Disease Control and Department of Medicine to share medical knowledge and medical equipment with Myanmar medics and officials. Among the latest projects is a collaboration with the Medical Sciences Department to develop a model for low-cost COVID laboratories to boost Myanmar's test and trace mission to contain the virus. TICA is also using digital technology to raise awareness of disease prevention in communities on both sides of the border, including for migrant workers. Measures feature teleconferencing to upgrade cooperation between provinces, online medical consultations between public health offices and district hospitals, and online tracing to help medics and officials in neighboring countries treat severely ill patients and also establish emergency operations center. And you have some images there of our work through TICA with Myanmar. The agency also runs a public health and medicine knowledge bank, TICA's knowledge bank on COVID, to share Thai experiences and expertise with neighboring countries. Via TICA's website provided to you, you can see that on screen in the form of a QR code as well, and YouTube and also other online platforms. And meanwhile, Thailand has delivered urgently needed supplies to our neighbors, medical supplies, including PPE kits, 1 million surgical masks, blood gas analyzers, 70,000 doses of favipiravir, and oximeters, and many other equipment. So you can see that our perspective is that we believe that to solve the COVID problem, the infection, we have to address it on a regional basis as well, because whatever affects our neighbors affects Thailand. Whatever affects Thailand affects our neighbors as well. So this is our outlook in terms of the cooperation with our neighboring countries. So just additional points for those following the English language briefing here, just to direct you once again to the newsroom of the Tourism Authority of Thailand, tatnews.org, which has updates on the control measures in various Thai provinces. You see on screen there that it has been updated latest on the 7th of January. I believe that's being updated quite often. So that's a good source of information for you about the measures on the provinces of Thailand in particular. Because as you know, of course, we give the authority to each provincial governor to come up with their own measures as necessary according to the situation and context of each province. And the website there you see on screen. And also, I'd just like to end by saying that we take this opportunity to thank, once again, all of our citizens, all of our foreign friends in Thailand, those in Thailand and abroad, for understanding the situation. Most importantly, your kind cooperation in this matter to ensure the safety of families and friends, and overcoming COVID, of course, requires a concerted efforts for us to play an important role in protecting the physical and mental health of ourselves and others. The spokesperson ended with some very important words, very touching words. Of course, as civil servants, as doctors, as policymakers, as foreign ministry officials like myself, as interior ministry officials, as policemen, border policemen, and all of those in the civil servant. The word civil servant in Thailand means that you are actually serving the people under the guidance of His Majesty, the King. Civil servants in Thailand serve the people, and that is what we intend to do. And we will not go anywhere far until this crisis is over, until we are able to solve this issue for all of our the entire society of Thailand, and of course to give ample warning and measures and advise to everybody in a straightforward and transparent manner, so that we can overcome this crisis together. The spokesperson ended with this picture, this infographic, and I'll talk just briefly about this before ending. So this is a quote that we had received from the Supreme Patriarch of Buddhism in Thailand, Somdet Phra Saṅඝราช. And the quote basically says that those who are born and they are constantly being assisted and helped, taken care of by others, for those people, it is considered that they are blessed with merit. But for those who are born and seek out to help others constantly and to make lives better for people, for other than themselves, for the general public, those people are blessed with even greater merit. And this is what we intend to do. This is what we intend to share with the society in Thailand, with all our friends in Thailand, those who call Thailand home. And we hope that globally the numbers will be lowered in due course. We hope that the country and the entire world will be blessed with greater merit as we help each other to fight off COVID today, tomorrow, and in the days and months ahead. Thank you very much for your attention. สวัสดีครับ
ครับขอบพระคุณนะครับท่าน